I'm so excited. I have got a lovely doctor with me. She's Ghanaian and she's going to tell us all about the MTI. So, if you leave me, I'm going to talk about her for hours. So, in order to avoid that, I would allow her to introduce herself and tell us all she wants us to know about her briefly. Hi,
Okay.
Eugenia.
Hi, Mabel. Hi, Mabel. Can you hear me?
Yes, I can.
Okay, so thank you for this opportunity and thank you and hi to all your lovely viewers. My name is Dr. Eugenia Enin. I formally did this MTI program in 2019 and finished in 2021. I'm a medical doctor if I did the MTI program. And I was a member of the West African College of Physicians, and I still am before I came into the UK. And I'm practicing gastroenterology in the UK. So I've got a lovely family, husband and 3 children. And yeah, I think I'm a very simple, basic, easygoing person who loves God. And yeah, that's it. Yeah.
All right. Thank you so much, Eugenia. I believe viewers out there all around the world are excited about this chat we're going to have. And I believe we are also having doctors all over interested in this MTI program. So to start with, MTI, what exactly does it stand for? Because I know there are numerous abbreviations out there in the UK. There's IMT, there's MTI. So can you tell us what it means?
Yeah, thank you again. So, rightly so, MTI usually gets confused with IMT, which is the core medical training for medicine in UK. But MTI is medical training initiative. So, M for medical, T for training, and I for initiative. And if I had to say a bit more about the program, it's a way of recruiting specialist grade doctors into the UK to sort of provide service and at the same time also take back skills that they have acquired from the UK back to their home country. Yeah.
All right. So which specialties in particular offer this MTI? Is it all specialties or is it just gastro? Is it any specific specialty?
So according to the Royal College of Physicians, every specialty should be able to offer the MTI program. Every
Mm,
not specific to any particular specialty. Um, but truthfully, the areas of interest are areas where there are obvious shortages in the UK, and most of
mm.
it tends to be in procedure-related discipline. But it doesn't necessarily mean that other people are not into this program. So I've met MTI candidates in psychiatry. I've met MTI
Mm.
infectious medicine. So MTI in obstetrics and gynecology, a lot of other disciplines. So it cuts across every sphere of medicine. Yeah.
Okay, that's really reassuring to hear because there are lots of specialties involved in this. So if you're a doctor watching and you are interested in a particular area of specialty, I believe you can look into this if this is something that interests you. The most important bit, I believe we all want to know, what's the eligibility criteria like? Who can apply for this MTI program? For instance, we've got various kinds of doctors. We've got doctors who just, completed medical school, fresh out of medical school. We've got those who are like SHO level or medical officers in their home countries. We've got those who are currently in a residency training program, and also those who finished, a particular specialty program and even consultants and all. So can you tell us what's the eligibility criteria like?
Okay, so I'm talking about the whole world now, not focusing
Mm,
on Africa only. So to qualify, I mean, you should have done minimum of 4 years postgraduate education. And
mm,
in simple sense, what that means in the UK is that you should have a membership of some sort. So if it's UK equivalent in medicine, we will say MRCP in medicine.
mm.
Surgical disciplines, there will be membership of the surgical college. Um, in Ghana and Nigerian training, I would say that would be equivalent to having finished residency in medicine.
Mm,
So if it's
okay.
in a medical discipline, I know obstetrics and gynecology have got a 1 year extra that they want people to have in addition to what all other specialties have to be able to
Mm,
qualify for the MTI training. So talking from where I trained, I would say the equivalence of a membership in the Ghanaian College of Physicians and Surgeons or the West African College of Physicians and Surgeons. So that's the minimum criteria. Additional things you need to do is English language proficiency. So what I mean
mm,
is the IELTS exam.
mm.
Okay, so you should have the IELTS exams, irrespective of what academic laurels you bring to the table. If you haven't passed the IELTS exams with the academic eligibility criteria, which is 6.5 for each of the sections, you
Okay.
yeah, you wouldn't be able to start this program. Um, yeah, and then you should be coming from a third world or an underdeveloped country. So, for example,
Mm,
me and you live in America, you probably, I'm not targeting a particular country, but I'm just saying that people from more developed and Western countries are not likely to be picked because the focus of the program is to help less privileged or underdeveloped countries like yeah, so I'm not going to mention any specific countries, but I'm sure we all understand what low income societies are. So
yeah.
basically, those are the priority areas with the MTI program. Yeah.
Okay, thank you so much, Eugenia. So just to add, I will be asking Eugenia for some useful websites just to signpost anyone who's interested. If you want further information, if you want to check to see if your country is part of, the eligibility criteria or falls under that, you could always have a look and confirm. So where can doctors find such offers for this MTI?
Okay, so I'll begin by saying it is very simple. Sometimes
Mm,
very huge to some of us because we don't take the first step. But it is very simple. So if you go to the Academy of Medical Royal Colleges, it is accessible by everybody and enter
mm,
Medical Training Initiative, Academy of Medical Royal College. You will have all the information I'm talking about, including eligibility criteria and application forms. Okay. There are two ways of entering this program, I must say, and my approach was a
mm,
different approach, which I will share. Because what happens with most people is that they look for the job and then apply, which is the common pathway. So if you go to you just enter on Google and say MTI jobs, it should show up
okay.
available to you. And it should not depend on where you are living. You should see them. I should say rightly so that if you are living in the UK already, you won't be eligible for this MTI training program. You should be in an overseas country to be able to start the program. Okay.
Mm,
So once you have searched for the jobs, if you went on the Academy of Medical Royal College website, you will get the application form or via the NHS hospital that has advertised the job. Okay, so
mm,
either through the NHS hospital that has obviously put up a job request asking for people to apply, or job opportunity, if I should put it that way, or you go to the Academy of Medical Royal College website and put in your application, hoping that if there is an available slot, you will be contacted. I anticipate that there might be a long waiting list with that option B, but it's definitely worth trying.
mm,
Okay, my approach was there was a job available and there was communication between two consultants who knew each other between Ghana and the UK. So it wasn't too difficult because the job was already available and it needed the
mm,
person. Yes. So that's option C, which is probably the least likely, but still very, very, very possible to have. If you work in a place like I'm not going to always talk about specific countries, but am I allowed to cite examples of what I know?
Definitely,
Yeah.
yes.
If you work in a place like Ghana, you can always check from the teaching hospitals by talking very closely with some of the consultants, and you will realize that
Mm,
there are some of them that may know somebody who knows somebody who knows someone who is into the MTI training. So luckily for your listeners, they know about this. I never knew about it. I was hit with shock. And so
wow.
if you already know, it's easier to ask around and say that, is there anybody in this department who knows about the MTI program? Is there anybody? And people will not always stick their neck out, but eventually you might fish out some information and get a heads up if there's an available job opportunity to come over. Yeah.
Okay. Wow. It's really good to hear that you can just even do like a Google search, like he said, and find out opportunities and things like that. I believe a lot of people are finding this insightful so far. So can I just clarify, does a doctor need to take maybe any form of exam aside the English test, the IELTS you mentioned? Is there any like a proficiency test or anything like that?
Yeah, that's a good question that I almost forgot to answer. So, because you are being employed into a middle grade job,
Mm,
which it would be at a registrar level, you will not need to take the PLAB examination for this MTI program.
okay.
Whatever membership um, or postgraduate qualification you have in your country of origin should be compared with its UK equivalent. And if it matches,
Mm,
be able to apply and fit. You don't need any medical examination aside what you already have, which is transferable. Does it make
wow.
sense?
Yes, yes, it does make a lot of
So it's
sense.
really great in the sense
Mm,
you bypass having to go through core medical training again
mm.
and not having to worry about PLAB exam as well, which is really good. It just means that you've got to focus on getting to consultant level. Yeah.
Okay. So I just want to clarify, when you say registrar level job, so is that like at the same level with like a specialist maybe in some other countries or
Yes. So in the UK system, it's a middle grade because we have it's more like a three-tier, I'll say it that way. So like a middle grade
okay.
with specialty training, and then
Mm,
we've got junior doctor. I believe that specialist grades are all part of everybody apart from the consultants is still part of junior doctors per se. But I mean,
okay.
it's those three levels. So you would work at a middle grade level.
Okay.
I must, however,
Mm,
say that you should be ready to step down in your role if needed to be able to learn the UK NHS system, which is
mm,
really different, and I believe that is the hardest part of the job. So sometimes, which is very common, and amongst almost everybody I've spoken to, some people have had to do like 6 months of stepping down,
okay.
and instead of working at a middle grade level to probably step down to like an SHO level
Mm,
of months. It depends on how quick you pick up things. Some could do for a month, some could do for 2 months, some could be 6 months, and some could stay even as long as a year, as long as it's taking you longer to get acquainted to things. And you should ask for that if you feel you need it, because as long as you've been asked to do the job, it will be expected that you deliver. So if you feel that you're
mm.
do not hesitate to ask for a bit of a step down so that you can observe things a lot more before. Yeah.
Okay. That's a very useful tip for those applying. It's very good to get some of these information firsthand to know what to expect when you start jobs. So with the application process, are there like long forms to fill? Do people have to pay particular attention to certain aspects, like maybe some essential criteria, desirable criteria? And in that sense, aside maybe having your postgraduate certificate after your residency training program in your country, should you be doing other things to help you stand out?
That we don't work with certificates, is what your hands can do. Okay, so in different places and different countries have got different ways of people having their training, but most importantly, anything that is skills dependent, you should not
Mm,
for example, if you come working as a registrar in cardiology, okay, and that seems like a big job that you can carry around and say that you are doing a training for. But if it comes to simple things like you can't put an IV cannula, which for probably people are specialist grade, some of them could probably not remember the last time they did one
mm,
places. Okay, so simple things that you think you haven't done before, these are the things that make you stand out. Arterial blood gas, basic things. Don't be looking out for the highfalutin things. For example, nobody will be asking you to go to a PCI lab to put in any coronary stents. Sorry, no, that's what
mm,
you'll be expected to do. So I'm not besting anybody's bubbles, but your initial year will really be people seeing that you can demonstrate what you have put on your paper that you can do.
mm.
So there are obviously forms to be filled, but these forms are basic routine procedures that everybody at the level of foundation minimum is able to know how to do them.
Okay.
It's not as easy as filling them, but to be able to demonstrate that you can do it. Do you get what I mean?
Mm,
Filling the forms is really difficult, but what you do after you fill the forms is the most important thing. So that's what I'm going to say, that especially if you are applying at, probably you're a consultant in your country, but you're thinking about coming to do a job like this,
mm,
and applying for the MTI training program, I would say go back to the basics and start what you've probably not done in a very long time, because those are the things that will distinguish between you and a house officer who comes to you struggling that, okay, I've got a difficult patient who I cannot do this for, everybody. I'm not saying that people cannot do one thing or the other, but if you wanted to do an endoscopy procedure, nobody will be surprised if you could do them because you've been trained to do it anyway. So it doesn't
mm,
matter. But when it comes to the basic things and you cannot do them, everybody will look at you in a different way. Do you get it?
mm.
So I
Yes.
think it's really important. Aside that, filling the forms, you have to do ECFMG verification. So all your
Mm,
certificates have to be verified by a body called the ECFMG. And permit me to see what the current charges are, because I know at the moment it's about 155 to 260 pounds to do one certificate
okay.
verification. If you change that to whichever country you are in, that is one of the first things they will be asking you to do when you get an offer of employment. Okay.
Mm,
The next thing is money for the IELTS exam.
mm-hmm.
At the moment is 167 pounds, equivalent to how much is being charged in Ghana, which is where I originally came from. So I don't know what will be the situation in people from other countries, but it's equivalent of 167 pounds per exam for the IELTS academic. Don't,
Okay.
yeah, so I'm not going to, what's the word to use? Discourage anybody. But the IELTS exams is an exam to take seriously, because no matter what you are bringing on your academic certificates, you could possibly write this IELTS exams more than once. So also put that in your planning in terms of budgeting, and don't be surprised if you have to take the exam more than once, and don't feel discouraged about it.
Mm,
Yeah, it doesn't mean that you are less intelligent in any way. It's just got its own criteria. And I think everybody that has moved to any country has asked for some form of English proficiency. And
mm.
MTI is quite strict to make sure that you have fulfilled the cutoff before you get into the program. So. Yeah.
Okay. Thanks so much for talking about, some of the costs
I
involved. You took,
cost of
yeah.
GMC registration, however, because you have to register
Okay.
for your GMC certificate as well when you find
Mm,
all the processes, and that could be minimum of about £500 to budget for us.
wow.
There will be other things on the fringes that will come up, but I'm sure one step at a time, um,
Mm,
a reason not to try what you want to do. Yeah.
okay. So I think the highlights are the cost of the EPIC verification, which you've mentioned. You've also mentioned the English test, which is the IELTS. I was wondering, can people do the OET as well? I know that's an alternative English test, or is it mainly IELTS?
It should be. It should.
Mm,
But the interesting thing is that their websites. If you give me a minute, let me see if they've updated to
okay.
include OET examination. Yeah. So
Okay.
they have the OET as an alternative.
Mm,
So they have the OET, and I have to say from the updated what they have on their website on the IELTS score that you need at least 7.
all right.
Yes,
Mm,
so at least 7 in each of the sections and an
mm,
of 7.5 overall, which is achievable. It's
mm.
achievable. Yeah. And the OE
Okay.
a grade B or above. Okay.
Okay. All right. Thanks. And yes, you did mention GMC registration as well. So, is there any application fee at all for this MTI, or is it free for people to apply?
I suppose if you went on the website that I have,
Okay.
which is the Medical Training Initiative by
Mm,
Medical Royal College, you will be able to get and on the forms. I've got the forms right here and I can click on them. But every additional information will be on there. I'm going to be honest that I can't remember if I did pay for any application fee in the
okay.
first instance. Yeah.
Okay. All right. Thanks so much. We'll be dropping the link to the website, like I mentioned, so doctors or viewers out there can access and have a look for themselves. So we've talked about cost. I was hearing like some £400 here, 100 and something pounds, £200 and all that. Like, yeah, it's even making me feel dizzy already. But can you tell us the exciting bits? How is the salary like? Is it good? Can you give us ranges, some numbers here and there, just for people to have a fair idea of how much they could be paid if they are successful with their applications?
Okay, so thankfully, with the information in the UK, it's readily available wherever you Google.
Mm,
So you can just
mm,
house and check what's the salary for a gastroenterology registrar and what's the salary for an obstetrics and gynecology registrar, and it's readily available. I would say usually it starts from 50,000 and over. But then
okay.
most times, because these are service provision jobs, most people get stepped down in terms of pay grade. Most people I know started off around 33, 35,000, at least in their first year
Mm,
of of working before they can negotiate a better contract. But most
okay.
yes, so I cannot. It's really difficult for me to put a number to every specialty because it really depends on your skill setting and then what
All
specialty
right.
you are in, and the on-call pay scale in addition, if you
Mm,
calls and all of that. So I'm sure all of this should be readily available if anybody is interested in checking. But I've given you like an overall perspective of what things could look like. Yeah.
okay. Thanks for that. So you have been through it. You are a former MTI fellow, and based on your journey, could you just share some experiences? What have been the good sides? And we know everything in life has the good, the bad, and the ugly. Can you just share a bit, just so people know what to expect? People hear discouraging things sometimes. Maybe they need to hear a few good things, to enable them make an informed decision as to whether they want to go into this or not. But I know this is going to be your individual opinion about this, but can you just tell us some of the pros and cons
Okay.
of this MTI program?
So the pros obviously outweigh the cons. I mean, yes, in everything you are doing, you have to sit down and calculate the cost, as the Bible says. So there's nothing that comes cheap or easy, but I would
Mm,
say that the pros outweigh the cons. For example, if you've got a family, you can move your children and your entire family, aside your parents, I mean your nuclear family, into the UK as dependents on your visa. So your partner is free to work like yourself on a skilled worker visa, not on a,
mm,
I mean, but as a dependent of yours on another visa. Your children can
okay.
school in the UK, and schooling
Oh.
in the UK, if you're not into independent schooling, is basically free, and which is good education. For me, family is quite paramount in most of my decision making. So I find it as one of my most important pros of this program. Secondly, you're bypassing having to go through, nobody is ignoring all you've done in Ghana. And I think that the UK system is very fair in saying that, okay, what have you got on the table? Bring it and let's have a look at it and pay you at a level that takes into account your skill and competencies, which is a wonderful
Mm,
opportunity. And most importantly, we should not forget about the benefits of this program on Ghana or whichever home country you're coming from, if it's Nigeria, Pakistan, India, wherever. It's going to benefit the country as a whole. If you imagine that people with this kind of skill set and return home and put it into use,
mm,
then your countries in respective countries is going to develop. So that is a very good pro. And I mean, aside that, if you went into training and you realize you have to pay for things like what have we called it, e-portfolio registration out of your study budget, pay for to be part of the Royal College of Physicians out of your study budget, tiny, tiny things that I really missed my time with the MTI when it was all paid for. Like you didn't have to, and every year they would keep automatically renewing it for you
wow.
whilst you're doing it. So yeah, I think that a lot of pros, to be honest. And with time, you realize that you evolve into a better person,
Mm,
version of yourself, and going through difficulty eventually strengthens your character and you become better. So the challenges are definitely a lot, but it cannot outweigh the benefits. Yeah.
okay. So what are some of the challenges that maybe you have witnessed or you've heard from other MTI fellows? I know probably being in a new system has its own challenges, getting to understand how things work and all such things. Can you just give us some tips or some information on some of the challenges people are likely to face?
Okay, so people that move into Western countries find it shameful to share their experiences. So I'm going to play like one of them and not say it tagged as encourager, and I don't want to be one. So there will definitely be obvious challenges of moving from one system to another. You will just feel like a fish out of water for a little.
Mm,
After a while, things will settle down and things will make sense to you. I mean, there are times people will look at you strangely, like, which planet did you come from? Because how you do things are totally different, And
yeah.
you would sometimes have to learn to watch more than you talk and
Mm,
be more observant instead of always showing that you've got things, that kind of thing. But I think my most important or most difficult period was getting used to the NHS system. That was it. But aside that, environment, weather, I mean, we all know that British weather can be unpredictable, but it's not really a big deal, to be honest. Food is readily available in the UK for those who will be like wondering, if I'm moving out, will I get everything I need? Everything you need. In fact, there's nothing that is back home that I haven't seen here. So that's also not a problem. So I think that challenges, because sometimes depending on where you trained, people peak very early, like sometimes when people get to the level of specialists, they tend to be more of hands in pockets type of doctor.
Mm,
It's a major challenge because people would have forgotten many basic things, which is a sad reality. But like I said earlier, that if there's anything you want to do now that you're considering it, is to go back to the basics. Yeah.
okay. Oh, Ishida, thank you so, so much. I really appreciate your time. I know we've been chatting about this meeting for a number of weeks now, and you've managed to squeeze, time for this. I can see you're probably even at work. I really
Yeah.
appreciate this. And I know viewers all over the world watching are
Yeah.
also grateful, for you sharing your insights, your personal experiences, and all that. So we don't take it for granted. We are so, so grateful. Do you have any final words for viewers out there? Um,
Well, I forgot to mention in the course of the interview that the program itself is for 2 years. So
okay,
the whole idea is a 2-year program. Okay. I did
okay,
mine a bit longer because of COVID, but otherwise it's usually 2 years, subject to extension, but normally it's a maximum of 2 years. And
okay.
have to return to your home country. So the whole idea of the MTI is not to keep people with their skills remain.
Mm,
Things were very different in my time because COVID happened and all the
okay.
rules got changed. But otherwise, you have to think about what to do after the 2 years. That will be my take home message for those who are considering what will be your next steps when you have completed the 2 years.
Mm, okay. Can I just ask then? So if someone for some reason is unable to complete that 2 year, program, what happens? Do they have any strict measures for that, or is there like specific conditions, people who undertake this MTI need to be wary of?
Well, this is a huge commitment, and I suppose that you wouldn't just get into the program without committing yourself to finishing it because
Mm,
life can happen, things can happen. I personally haven't heard anybody that has not completed. On the other hand,
okay.
I must say that I've heard people who have come and switched from the MTI before the MTI ended. Do you understand?
Mm,
So if they had an MTI visa of 2 years,
mm,
probably 6 months along the line, they changed jobs. I think the decision is actually for whoever makes that decision. So if you want to make a
okay.
decision like that, it's totally yours. The main reason being that, and the reason why I've seen people do that is because on the MTI visa, you are on a tier 5 visa. So
All right.
all the period of the MTI does not count towards your ILR.
Mm,
Indefinite leave for to remain. Sorry if I got it right. So indefinite leave to remain, which in the UK is 5 years of staying here, isn't it? So
mm,
MTI for 2 years or 3 years, it still doesn't count. So some
okay.
people, in trying to think smart, probably quickly change. I would not advise that if I was speaking for myself, because I think that I benefited from the time when I worked with the MTI program because there's a huge support from the Royal College to make sure that
Mm,
skills and competencies you need are supported so that you get them. But
mm,
onto a service job is really means that you are providing service and there's no requirements on your employer to train you in any particular skill. Doesn't make sense. Yeah.
yes, yes. All right. Oh, that
Yeah.
was yeah, that was very, very useful information you shared. All this, would help people to make an informed decision, plan ahead as well. Rather than the theoretical bits, that people read on the website, it's helpful to have a chat with someone who's actually been through it, like Eugenia, who's shared her experiences, and she's also told us, things to look out for and signposted us, to useful websites and all that to help all doctors out there interested in the MTI program. So thank you, Eugenia. Thank you so much for your time. I hope we can host you again in future to talk about other things as well, which will benefit doctors out there. So please, like if you haven't already liked the video, share it to other doctors, share it with other doctors who may be interested. Don't forget to drop a comment to appreciate my guest, Eugenia. And I'll see you in my next video. Thank you, Eugenia.
Thank you.
Bye.